Good evening, everybody. So sorry for the hiatus last week. I took a little vacation. So I wanted to talk a little bit about urinary tract infections, particularly the non-complicated kind. Now, this is something that many women are familiar with, and a few men. Basically, the feeling of needing to void or pee urgently, frequently, with burning, with pain, very uncomfortable, and women have tried for many years different kinds of over-the-counter things in order to try to mitigate those symptoms. Very frequently, we know that drinking lots of fluids and cranberries are kind of folk tales as to be able to help prevent or try to help flush out a urinary tract infection when it's there. However, the data on cranberries, although the cranberries in a high enough concentration actually make it harder for the bacteria that usually cause urinary tract infections to stick. See, these bacteria have got these little finger-like projections on them, and those things have got to kind of stick to the walls of the urinary tract in order to cause the infection. And there is something in cranberries that can inhibit that and block it a little bit. But generally speaking, the amount of cranberry juice that would need to be used in order to completely block that seems to be pretty high, at least from what I've seen so far in the literature. But cranberries are extremely good for you anyway, so highly recommend having them in the diet on a regular basis, regardless of whether or not they completely block a urinary tract infection or not. The main source for the bacteria that get up into the urinary system is actually the next door neighbor, the rectal area. So what happens is that when we eat certain foods, they get into our gut, and sometimes the bacteria that are down in the nether regions, as it were, can kind of crawl around and get up into the urinary area to some degree. Which is one of the reasons why women have a much easier time of getting a urinary tract infection than the men do. Because when the women have a much shorter urethra, and it's just a lot easier for the bacteria to make it from one location to the other. Men, of course, have a little bit of a longer appendage there, and it is a little bit harder for the bacteria to get up and in. Men will have more often, if they're having these symptoms, especially if they're younger, will tend to be more commonly a sexually transmitted disease. Sorry guys, but chlamydia and gonorrhea are way more common in your age range in the younger population. For the older gentlemen, sometimes if the prostate gets enlarged, it can kind of block up the urine, and they'll be a little bit more likely to get a UTI in that case. And for the guys, usually because there's more involved, usually it's a little bit more of a complicated regimen, and they need longer antibiotics and so forth. So without getting too much into all those details, just a quick overview there. So there's an interesting link between, speaking of things that are eaten and then get into the gut and cause this, there's an interesting link between the consumption of chicken and urinary tract infections. And it was about in 2012 that they actually found the DNA fingerprints, so to say, of bladder infecting E. coli that were found in contaminated chicken samples. And about half of all the chicken that is purchased in this country has some degree of contamination from poop in its area. And the fecal bacteria basically get on them, and it's thought that basically through cross-contamination while trying to clean things up and make things in the kitchen, that bacteria kind of spreads around. There's some interesting video presentations on nutritionfacts.org talking about the attempts that people have made to try to stop the cross-contamination of bacteria in general from things like raw chicken, and it turned out that in the ultimate analysis, the only way to really prevent that cross-contamination was to get full gowned up, spraying things down with bleach, and essentially not quite as dramatic as flame torching everything, to keep the place sterilized, but it was pretty intense, the rigors that the lab had to go through in order to finally be able to have the chicken and then check things around the kitchen in their mock-up there to be able to find a way of doing it without getting that chicken bacteria all over the place. So anyway, a little bit more on that later if you want to check it out. There's an interesting series there. A little note about cheese skippers, which is a cheese fly larvae with some well-aged cheeses. Hopefully, I don't know if that's very common out there that you guys are eating this stuff, but that's another little interesting side note. There's actually some other interesting correlations between urinary tract infections and some other health problems. So the main bacteria that cause the most urinary tract infections is E. coli, but a close second is this other bug called Proteus mirabilis, and it is an interesting bacteria in the sense that when the women have frequent urinary tract infections, they start to get antibodies against this bug, the Proteus. And unfortunately, when the body is attacking this bug actually resembles some of the molecules in our own joints. And so there is a possible correlation between the urinary tract infections and later development of some autoimmune diseases like arthritis or lupus or things like that. And then, of course, can be a risk factor for premature birth. Anytime a woman gets an infection in general during pregnancy, it could be a urinary tract infection or a vaginal vaginitis kind of thing. There's a little bit more risk of complications in general from the pregnancy. Pregnant women are a little bit more susceptible to urinary tract infections and also kidney infections because their bodies just are full of extra fluid, and that extra fluid is circulating around the kidneys, and just the anatomy, how things kind of shift around, ends up making it easier for those kidneys to get blocked and take on the extra fluid and cause problems. So, of course, vigilance is needed at all stages of pregnancy, but if someone's pregnant and they get these frequency, urgency, burning on urination signs, please talk to your physician especially. So anyway, some other interesting things. There is an association between urinary tract infections and later on breast cancer. And so what they're conjecturing as maybe the plausible cause of that is whenever you get these urinary tract infections, what do? Is we reach over the counter and we get ourselves some antibiotics. Truly over the counter in some countries, but at least in the US you have to go through a prescription, but it's a pretty easy prescription to get usually. And so the antibiotics go in, they kill off the bad bugs, but they also unfortunately kill off the good bugs too, the good gut bacteria, and that can absorb or block the absorption of some of the really protective factors in the plants, such as the lignans. And if you've got low levels of lignans, there seems to be a higher risk of breast cancer. And so this is one of those things I mentioned in the flaxseed video. Flax seeds are extraordinarily rich in these little things called lignans, and the women that consume the flax seeds seem to be at a lower risk of developing breast cancer, and the mechanism is thought to be related to the amount of lignans that they're getting. So basically, the higher the level of lignans in the body, they're antimicrobial of themselves and thought to be able to help kind of clear the body of that Proteus and the antibodies and help the joints to not be quite as much trouble. The other thing that's helpful about a diet which has a lot of plants in it is all that good phytonutrients, all that good fiber. It just tends to really feed the good gut bacteria and basically kind of push out the bacteria that tend to cause more infections and such. So the amount of time that the chicken is cooked doesn't seem to make any difference, is because the cross-contamination happens even before it gets through the cooking process, and all that. So we talked a little about the cranberry juice maybe being able to help by keeping the bacteria not quite as sticky. The things that I'd seen previously about that tended to show that you needed a lot of cranberry juice, like liters of cranberry juice, to really fully do the trick with it. All right, now switching over to Dr. Barnard's article from the Nutrition Facts, just seeing if there's any missing pieces. We talked about the E. coli being very common. We talked about that study from 2012 with the chicken and the symptoms. Oh, yes, this is an important thing too. So, urinary symptoms are very common in the young, as well as the very old. But in the younger folks, basically you get the symptoms are maybe irritability, they might not eat as much, they might have incontinence, they might pee their pants, for example, or they might have some diarrhea. So the young children don't always tell you what's happening. But I know that many mothers that are watching might be able to say, oh yeah, I know when my kid's having this because their pee smells different or because they get this look about them or something like that. So, and in very young girls, sometimes just vomiting or not being able to fully void might be the only symptom. So things to be aware of. In the elderly, who also are susceptible, especially if they need to be in, for example, diapers because of incontinence or other kinds of things, not being able to fully take care of themselves as much as they used to be able to. Basically, the bacteria gets into the blood and causes confusion and other mental status changes. So if somebody is acting normally and then all of a sudden they're delirious, they don't know where you are, who you are, what's going on, then it could be a sign of urinary tract infection. So again, something to talk about as well. Sometimes there can be a little blood in the urine, sometimes the urine can be cloudy in general, fevers, nausea, vomiting, and if it gets into the kidneys, pain right in the flank area as well. Let's see. Over half of women will have a UTI in their entire lifetime, and over 20% have at least two. For women who are recently married, actually, that is a risk factor, or simply having more partners or more recent sex or more frequent sex seems to be a risk factor. And other things such as spermicide use, for example, again, changing the pH of the area and making the urethra a little bit more damaged or at risk of collecting bacteria. Let's see, so other things, catheterizing the bladder. Sometimes people who are, for example, might be paralyzed or other reasons that they might not be able to have as good control, sometimes they have to use a catheter. In the hospital, sometimes the catheters are associated with urinary tract infections, commonly actually. Sometimes there's anatomic abnormalities, like the urine goes backwards up the tubes towards the kidneys and can cause problems. Kidney issues with regards to diabetes and other things. If the nerves going to the bladder are not functioning well, for example, those all are different kinds of things that increase the risk of getting a urinary tract infection. And unfortunately, after menopause, when the hormones kind of dry up, so to say, it ends up with the tissues in that entire area being more friable, more fragile, less full of blood, less full of nutrients, and basically it causes sometimes painful sex, but also can cause more likely to get urinary tract infections as well. Let's see. Another thing to watch out for is cigarette smokers. So if someone is a tobacco user or a former tobacco user, that tobacco, we all think of tobacco as causing like lung cancer or chewing tobacco causing head and neck cancers, but it really increases the risk of all sorts of body cancers. When the body is filtering out the toxins from the tobacco, regardless of whether it's chewing or smoking or whatever, it actually filters it through the kidneys and it collects in the bladder. And so basically the risk for bladder cancer is much higher in folks who have used cigarettes, even if they've quit for a while. Basically, the transitional cell carcinomas are related to the bladder holding on to the carcinogens for a little while, and then you flush and pee, and then it collects more carcinogens. And over time, that exposure can cause those scans as well. So if you happen to be a former tobacco user and you get blood and irritation and such, please make sure you talk to your doctor about, what about cancer? You know, what's my risk factor for that as well? And again, if you get bacterial infections that keep on coming and coming and coming, then please, again, talk to your physician. There's a lot of different things that can be done. For the people whose urinary tract infection comes after sex, for example, occasionally we'll give like a little dose of antibiotic to have just when the need arises, so to say. Basically, physicians have been saying for many years, make sure you pee after sex, wipe in one direction, you know, so in other words, front to back and so forth. There doesn't seem to be actually a lot of evidence to show that that is the case, that it's actually helpful, but we do generally recommend careful personal hygiene and plenty of fluids, timed voiding, for example, emptying the bladder every 3 to 4 hours. For example, the healthcare nurses and workers who are stuck on the floor and not able to get away to pee for a few seconds, they actually accidentally put themselves a little bit high risk for getting this. And similarly, many other folks, if they're not able to pee at least every 3 to 4 hours, or if they forget to drink fluids, those kinds of things do put you at higher risk. There is some evidence about Lactobacillus, and there's, in one study at least, the women that had the Lactobacillus probiotics had an 80% lower risk of getting a urinary tract infection. I think mostly because of, again, having lots of good bacteria go through there. The nice thing about Lactobacillus is it is really, really easy to grow yourself in homemade yogurt. If you want to check out my little video on homemade soy yogurt, can tell you a little bit more about that. We talked about the flavonoid-containing juices, basically the cranberry, and I guess there's also something with lingonberry. The women that tend to drink that tend to be a 20% lower risk than the people that don't have that in particular, but again, we don't have a lot of strong evidence for that other than the fact it tends to have an association there. And high fiber diet. So again, because the good fiber changes the gut bacteria a lot and makes it a little bit more likely to be protective against different things. There's also a risk between constipation and urinary tract infections. So maybe because when things are bound up, maybe the bacteria tends to move around more. Who knows of the reasons exactly, but the bottom line is eat your fruits and veggies, and it should be very helpful in general. Alrighty. Another tip about breastfeeding, and for the children who are lucky enough to be breastfed, the body creates antibodies against pretty much all sorts of things. And when the milk is coming out, some of the secretions that the body makes, like for allergies and along the gut, it's called IgA. It's basically the way that we protect ourselves from infections and such in general. And the immunoglobulin A that's secreted, that's in the breast milk, basically helps the baby's gut lining be a little bit more better, I guess is a short way of saying it. And so the gut bacteria that are in the babies that are breastfed is also a little bit different, and there seems to be less of the type of the E. coli with those little finger-like projections that like to stick to things like urine walls and stuff. Is lower. So generally speaking, the babies that are bottle fed tend to have about twice the risk of urinary tract infection compared to the babies that were breastfed for about 7 months at least. And the benefit was particularly better in the female babies as well. So just another support for the idea of breastfeeding when possible. Of course, not everybody is the same, and everything is to be taken as it were. Alrighty, so I think that's the main things that we had on the docket to talk about today, getting into the details about what type of antibiotic. That kind of stuff is always going to change because of the unfortunate antibiotic resistance that is out there. But for the most part at the moment, usually anywhere between 3 and 5 days of antibiotics for most very simple urinary tract infections should be able to do it. And then there is something that people take often called azo, or pyridium is another word for it. Those are the tablets that are like a urinary analgesic. In other words, it numbs up the urinary tract. The azos you can take over the counter, and people like it because it takes away the symptoms, but it's not an antibiotic. It doesn't really get rid of the bacteria so much. Just makes it a little bit more tolerable to have a UTI as well. So, and the other downside of doing that before doing a urinary test is that when it turns the urine like fluorescent orange, it kind of interferes with the automatic readers that are trying to figure out, hey, is it cloudy, is it got blood in it, and things like that. So occasionally, if someone takes the over-the-counter medications, it can sometimes mess up the diagnosis of the UTI a little bit. Anyway, so I think that pretty much is about all I want to cover for the topic of urinary tract infections today. For some reason, we've just had a bunch of them come through the clinic in the last week or so, so it seemed like a good topic to go over. I hope you enjoyed, and I hope you stay healthy, wealthy, and well. Drink lots of fluids, eat your fruits and veggies, and stay healthy. Okay, thank you for watching. Bye-bye.